So again, good morning, and thank you all for joining us. Please know how much we appreciate the good work of the independent press, and how much we appreciate your taking your time to be with us here today to talk about this important issue at this crucial time. I'm Dr. William Gallea. I'm a past president of the Montana Medical Association, still an active member of the Legislative Committee and the Board of Trustees. I'm an emergency physician and have been practicing medicine for 48 years. We are joined today by colleagues from the Montana Nurses Association, the Montana Hospital Association, and the Montana chapter of the American College of Pediatrics. Collectively, we represent thousands of healthcare providers from all across Montana. And collectively, we are overwhelmingly united in our message today. That message is that Montana's healthcare providers should not face 20 years in prison for providing quality care. That message is, we are lifesavers. We are committed to the highest quality care for all of our patients at all phases of their life. And that includes quality, compassionate, palliative care at the end of life, no matter the age. That message is Legislative Referendum 131, which affirms the Born Alive Infant Protection Act, is not necessary. Infants born alive are already protected by clear state and federal legislation. And finally, our message is LR 131 is a blatant intrusion of the government into the private and sacred relationship between our patients and their physician. This morning, you're not going to hear opinion. You're going to hear stories of the all too frequent situations where families whose children cannot live are given the care that they deserve. You're going to hear from a mother who has lost a child under these circumstances. You're not going to hear about abortion this morning. The MMA, MHA, and MNA do not have a position on abortion. Our discussion will center on the heartbreaking issues surrounding pregnancies that are neither normal nor healthy. These are tragedies, not crimes. And these tragedies should not be made into crimes. You will hear from Dr. Holbrook that not all babies who are born can live. Some are born far too early. Some are born with complications that simply make them unable to survive. For families experiencing these tragic pregnancy complications, the ability to provide comfort to their child in a quiet and supportive environment immediately after birth is often crucial to working through the grief that follows these losses. If LR 131 passes, healthcare teams will be forced to give these infants futile and often painful procedures. You may have read from proponents of LR 131 that the legislation permits, quote, humane comfort for those who are not likely to survive, unquote. But the Born Alive Infant Protection Act has no provision allowing this care. Nowhere in the legislation are the terms, quote, appropriate and reasonable medical care defined. If the intent of LR 131 is to allow compassionate palliative care, then why not state that explicitly? It does not. And if that is the intent of the legislation, it is clearly not necessary, since that is already our standard of care. On behalf of the thousands of healthcare professionals that we represent today, we ask each Montanan to vote no on LR 131 and stand against unnecessary government overreach into our medical care. Montanans will find this initiative on the back of their ballots, having been placed there by the 2021 Montana legislature. Each no vote will keep the decision-making in the hands of parents and their medical providers, and out of the hands of the legislators and the courts. At this time, I'll turn the floor over to Dr. Brad Holbrook, an obstetrician and a maternal-fetal medicine specialist, and an expert in caring for patients and infants in high-risk pregnancies. Dr. Holbrook.
Thank you, and thank you all for being here. So as was mentioned, my name is Brad Holbrook. I'm a maternal-fetal medicine specialist practicing in Missoula, Montana. As a maternal-fetal medicine specialist, I have the privilege of being present for some of the most intimate and happy moments of my patients' lives. I truly love and care for my patients and their babies and do everything within my power to save the life of every patient that's entrusted to me. Unfortunately, in my line of work, I also bear the burden of sometimes having to deliver terrible news to parents. I have to tell expectant parents that their baby may not, and very likely will not, survive much past birth. Now, sometimes that means a few days, sometimes that means a few hours, sometimes that means only a few breaths. Regardless, in any of these cases, my job is to provide parents with all the information that is available and help guide them through some of the most difficult decisions they will ever have to make. In some cases, the family decides they would like the baby to be taken to the NICU for a full attempt at resuscitation. That's an appropriate option. In other cases, the vast majority of cases in my experience, the family decides that what they would rather do is hold baby in their arms and give baby a warm, loving environment as baby passes away and spend as much time with that baby as they can. That is also an appropriate option. The problem with LR 131 is it does not give the parents either of these options. It mandates that they must receive medical care for their infant. Now, these situations can occur due to a number of different reasons. The two biggest ones would be lethal fetal anomalies or previable deliveries. So spontaneous previable deliveries is something that occurs, and we know that previable babies that are born in the previable period often weigh less than a half of a pound. They'll literally fit in the palm of your hand. They're often born alive but pass away soon after because their organs are just not mature. There's nothing that we can do as a medical community to help these babies to survive, despite all our best intentions and our best efforts. However, the language of the initiative specifically mandates intervention for babies born, quote, at any stage of development, end quote. That's a direct quote from the law that babies at any stage of development must be cared for if they have a heartbeat, move, or make efforts to breathe. These criteria would apply to many of these pre-viable infants who again have zero chance at survival. So intervention for them will do nothing but harm, as there's nothing that will change that course. The proponents of this ballot initiative make a number of claims which are incorrect or untrue. The most egregious of these, in my experience, is the language in the voter information pamphlet that refers to spontaneous pre-viable births as, quote, mythical. I can tell you they absolutely are real. I, unfortunately, have been in the room for all too many of these deliveries and have had to comfort and help women through the grief and heartache of delivering a baby at a pre-viable gestational age, knowing that there is nothing that we can do. The causes for this could be spontaneous preterm labor, rupture of membranes, infection, or other causes. To discount these poignant events by calling them mythical truly hurts me to my soul, and certainly does the same for the women who continue to live with the grief of having lost a baby. In the state of Montana, we average somewhere between 11 and 13,000 births per year. Based on published rates, that would mean that each year there are at least 40 to 50 babies born in the state of Montana that do not survive beyond birth. LR 131 would take away the rights of the parents of these babies by not allowing them to select the medical care they feel is most appropriate for their baby. It seems that this law was targeted at abortion, as was mentioned earlier, but realistically, it has nothing to do with abortion. There's a narrative that a baby could survive a late-term abortion and then simply be left to die. That sounds horrific. I think we all agree that that would be horrific. The problem with that narrative is that it just doesn't happen in Montana because there's already 2 different laws that would prevent that from being the case. Firstly, abortion is illegal at viable gestational ages. So a late-term abortion is already against the law. Secondly, infanticide is illegal anywhere in the United States. Therefore, this law, LR 131, does nothing to prevent this situation that's being described. Another thing that's been described is, well, what if a baby survives an attempted abortion at a pre-viable gestational age, but then survives into the viable period? Well, the answer to that question is, well, then that's a live infant, and that infant would be cared for just as any other infant would be. To do otherwise is called infanticide, and again, is illegal anywhere in the United States. So this law, A, has nothing to do with abortion, and B, it adds nothing to existing laws that would prevent any of this. But an important thing is that it will provide harm and cause harm to these families, these grieving families in Montana. Another major problem with the initiative is that its language is vague. As was discussed already, it requires that, quote, medically appropriate and reasonable actions, end quote, must be taken to save an infant's life. Proponents have argued that palliative care for the infant would fall under this umbrella. Perhaps, but there are no specific exemptions in the law. And what that means is that any of us healthcare providers would be at risk, that if someone disagrees with the plan that we and the patient thought was reasonable and appropriate, that then we could be subject to legal proceedings. We could be subject to a long investigation, even if it was the most appropriate care. And in the worst case scenario, we could be arrested, lose our medical license, and be in prison for 20 years. And all of that for simply providing the best compassionate medical care to our patients. Since first hearing about this initiative, I've been thinking of the many, many patients I've been privileged to care for in these scary, terrible situations. I'd like to take a few moments to tell you about one of them. I met this very sweet woman due to lethal fetal anomalies unexpectedly discovered on a routine 20-week ultrasound. We had multiple visits throughout her pregnancy. At each visit, I would hold her hand as she cried these tears of just immense grief. Throughout her pregnancy, we developed a plan. She carried her baby to term. When she reached full term, she came in on the scheduled date, had induction of labor, and just had a beautiful delivery. I took baby, handed baby to mother, and placed her on mother's chest. Mom held her tight and close as baby passed away. We had family members, we had siblings, we had spiritual care all present to help. This mother later told me that this experience of meeting her child, who only survived for a few moments, was one of the best experiences of her life. I can't help but think about how different her experience would have been had LR 131 been the law at that time. It would have mandated that her baby be taken from her arms and undergo cold, sterile medical interventions that would have no bearing on the chance of that baby's survival. I still cannot fathom why a politician or anyone else would want to keep a grieving mother from holding her baby as it passes away. While it may be an unintended consequence of this law, it is one that is real and that will have negative impacts on families in Montana. If passed into law, LR 131 will mandate medical treatment and prolong suffering regardless of the family's wishes. It will also make compassionate caring physicians into criminals for providing the best level of compassionate care. For these and for many other reasons, please join us and help protect grieving Montana families and vote no on this harmful ballot initiative. Thank you.
Can you hear me? I'm Dr. Erin Green, and I am a pediatrician. I am one of your local Helena pediatricians. I take care of your kids in my office and in the hospital when they need to go there. I really love going to and being part of newborn deliveries. It's a very, very happy time. But sometimes it's not. Not every baby born will survive for any number of reasons. The very first patient I ever had pass away in my pediatric medical training was around the holidays and was a very premature baby who had suffered a devastating, unpreventable medical event soon after delivery due to their extreme prematurity. The parents then had to make the hardest decisions of their lives: prolong their child's suffering with extensive medical intervention from our team that ultimately would not change the outcome, or choose to unhook all the medical equipment, hold the baby, bathe them, and shower them with love for their few precious final moments of life. I cannot imagine having to make this decision, but I'm so grateful that my patients' parents were able to make this decision. Neonatal Intensive Care Unit, or NICU care, is extraordinary. We have made unbelievable strides in neonatal medicine that have helped us to save more babies than ever before in history. But all the time, babies are born too early to survive. They have catastrophic, unavoidable medical events that happen, like my patient, or they're born with conditions that mean they'll only survive for minutes, hours, or days. And with that, I'm going to read an excerpt of a letter from a Montana NICU nurse. She gave her permission for this to be read. My absolute favorite part of my job is helping parents hold their baby for the first time, hooked up to breathing tubes, IV lines, and monitor wires, and placing them skin to skin with their mothers. I've had the honor of being part of a truly amazing experience. But sometimes I am helping parents hold their babies for the last time, or only time. We live in an amazing time where lethal fetal anomalies can be detected by ultrasound before birth, and gives the families and doctors a chance to discuss the prognosis and plan of care. Sometimes that plan of care is to place the baby in mother's arms and let them pass in peace with the love of their family surrounding them. Newborn palliative care is heartbreaking, but also beautiful to give a dying baby a few precious moments and breaths with the family. Some of my most special memories as a NICU nurse is bringing families outside the hospital where their baby can have breaths of fresh air, feel sunlight on their skin, hear birds chirping instead of monitor alarms, and pass in peace. LR 131 would take these moments away. LR 131 is on the ballot that just arrived in your mailbox. The referendum mandates that all babies receive life-saving measures. It would require our team to take the baby and perform painful and invasive resuscitation efforts that will ultimately have the same result and not save the baby. And those precious moments for the family will be lost. We will place the baby in mother's arms, broken and lifeless. Those who experience this, both parents and healthcare workers, understand this heartbreak all too well. On the outside looking in, LR 131 sounds reasonable. All babies deserve life-saving measures. But the results are detrimental when politicians are proposing laws with no real understanding of what it means for very wanted babies with heartbreaking prognoses. Proponents say that water breaking at 20 weeks is mythical. It's absolutely not. It's very real. And the high-risk doctors and OB nurses do everything they can to buy time and save the baby. Sometimes it works, and we can get the baby to a viable gestation, and our amazing NICU team will care for the baby born there. And sometimes it doesn't work, and the baby will come too early and is too small to save. This is one scenario of many that we encounter. Those babies belong in their mother's arms, not getting breathing tubes and chest compressions from strangers in a sterile OR. Here's the truth. If parents wish for full resuscitation, they want everything done, we will do that, within reason and with consideration of the size equipment only comes so small. If parents wish for their only and final moments with the baby to be unencumbered by medical procedures, we honor that. This isn't about pro-life versus pro-choice. Many of the opponents of this bill are very pro-life. This is about not allowing politicians to dictate something that they don't understand. This is about how healthcare workers, like myself, are involved in perinatal death, will face fines and jail time for simply doing the right thing for babies and families. In conclusion, this law could put me, your local pediatrician, or your community's incredible NICU providers in jail for providing compassionate, family-centered care. Please vote no on LR 131.
Hi, everybody. My name is Kelly Hunt. I'm a registered nurse in Montana for the past 15 years. I received my master's in nursing from Montana State University and I'm certified as a clinical nurse leader. I am currently the Director of Professional Development with Montana Nurses Association. M&A stands firmly against LR 131. The nursing profession is based on advocating for patients and providing compassionate care across the lifespan. This includes creating a safe space for grieving parents to have precious time with their child in the unfortunate event that the child is born with a condition which is not compatible with life or born before the age of viability. LR 131 criminalizes private health care decisions made in unfortunate circumstances and forces a care environment in which nurses would be providing futile resuscitation efforts rather than the compassionate care that is so essential for grieving families. M&A supports all nurses and healthcare providers and recognizes the secondary trauma that repeated exposure to these types of situations would certainly cause for everyone involved. M&A is the recognized leader and advocate for the professional nurse in Montana, and we represent over 3,000 members. M&A promotes professional nursing practice standards and education, represents professional nurses, and provides nursing leadership in promoting high-quality health care. To that end, we recognize the detrimental impact of LR 131 on nurses and other providers, specifically those practicing in labor and delivery and NICU settings, as well as the negative impact it will have more broadly on the profession of nursing. The past 2.5 years of a global pandemic have stressed nurses morally, physically, and spiritually in ways that we have never seen before. LR 131 creates a whole new threat to the well-being of our nurses and the families that we serve. Please join us in voting no on LR 131.
Hi everyone, thank you for being here today. My name is Dr. Lauren Wilson. I'm a pediatrician. I'm the current president of the Montana chapter of the American Academy of Pediatrics, which represents 160 pediatricians in Montana, which is nearly all of them. Some of these pediatricians are neonatologists, pediatric hospitalists, or community pediatricians who attend newborn deliveries. These people could be criminalized by the initiative should it pass. As pediatricians, we work with parents as the decision makers for their children's health, through thick and thin, easy decisions and hard ones. We have a model for shared decision-making in healthcare. We offer our expertise, and parents incorporate their own personal values, family logistics, religious beliefs, and more into making the right decisions for their children's health. As pediatricians, we think LR 131 is an unnecessary interference with the rights and decisions of parents in tragic situations. I'd like to take a moment to counter some of the claims out there about this initiative in more detail. First, proponents of this initiative are saying the initiative doesn't mean what we say it means, that parents can still decide to forego life-saving care if it's not appropriate. The truth is that this initiative does not in any way make clear that parents can decline fetal care. It does not make clear that the mandate to act to preserve life and health won't apply if a baby has a life-limiting condition and could never survive long-term. There's nothing in the law that says that. In fact, quite the opposite. Language to explicitly allow families to make these decisions for their children was present in model legislation from national groups like Americans United for Life, but is entirely absent from this bill. Proponents say that no one would prevent us from, with families' wishes, not providing care aimed at preserving or saving lives. They have not provided for that in this initiative. Without that guarantee, it's our lives and livelihood on the line if parents feel comfort care alone is the right thing for their family. This bill has made no provisions for parents as decision makers for their children. Second, proponents say this bill is necessary, that it's filling a gap. The 2002 Federal Born Alive Infant Protection Act is a simple and effective law. It defines an infant born alive at any stage of development as a person, entitled to all rights and protections that entails. This means they have the right to obtain medical care and equal legal standing with anyone else in that regard. Guidance from the federal government tells us that EMTALA, or the Emergency Treatment and Labor Act, as such, explicitly applies to these infants. They require medical screening and appropriate stabilization. This is what parents want and need for their children. Additionally, Montana Code Annotated, as provided by the Montana Abortion Control Act, already criminalizes anyone who purposefully, knowingly, or negligently causes the death of a premature infant born alive if the infant is viable. Third, proponents have claimed that this doesn't include natural birth and that spontaneous preterm labor, or that situation where natural birth does occur early, is a mythical situation anyway. This is untrue. The first is clear on a plain reading of the initiative. Natural birth is listed and included in the text, but this has been minimized or hidden by proponents. In fact, the American College of Obstetrics and Gynecology and the Society for Maternal-Fetal Medicine have asked for a correction to the proponent's statement in our voter information guide, in which the writers misquote their own initiative to leave off the phrase natural labor. We're here to tell you as medical professionals that these situations do in fact happen, not infrequently, and that nothing in the language of this bill means that it does not apply to natural or spontaneous labor. Fourth and finally, proponents claim that we're protected by the phrase medically reasonable. This is vague. You're asking us to put our freedom on the line with 20 years in jail at stake for a phrase, medically reasonable and appropriate measures to preserve the life and health. There is no universally accepted standard of what is medically reasonable, and this initiative does not define it. In fact, this can be inherently contradictory. In some cases, acting to preserve life is not, in fact, appropriate medical care. Not only is there a provision for anyone to report what they feel is a violation, this initiative makes it mandatory to do so with penalties if one does not report. Compassionate and patient-focused care in situations where infants have no chance of long-term survival and their parents decline invasive intervention often involves no medical procedures at all. This bill would put us at risk of criminal prosecution for doing just that. No physician wants to override a parent's wishes and provide medical interventions for a newborn for whom that would cause pain. But no physician wants to go to jail, especially for not supporting parents' decisions with compassion, but this law would put us in exactly that position. Pediatricians in Montana are committed to the health of kids. Our hospitals and doctors' offices are providing care in the face of massive challenges with our workforce. If you want to support quality healthcare in Montana, don't seek to criminalize its doctors, nurses, and other professionals. Don't accuse us of not caring for our patients or worse, harming them. Don't ask us to override the wishes of parents, and don't make us run the risk of jail time for providing compassionate care. Thank you.
Almost good afternoon. Can everyone hear me? Okay. I'm Dr. Melody Cunningham. I've been a pediatrician for nearly 30 years. I've had the honor and privilege of being a pediatric hospice and palliative care physician for 15 of those years. It is through walking journeys with families who know that their precious infant will not survive that I can speak directly to the unfathomable harm that LR 131 would cause to infants and families. It would bring unimaginable emotional and physical pain to loving Montanan parents and their infants diagnosed with illnesses or anomalies that would not allow them to survive. You've heard about the laws and protections already in place for infants born alive. I will ask you to go in a different direction. I will ask you to journey with me to the bedside and beyond with these parents and their infants. This request will likely be hard for many of us, yet I think it's imperative for you to join me. To enable you to have even a glimpse into what passage of LR 131 would mean for these families and their infants, I invite you to remember a time when you or a close friend has had the sacred opportunity of being able to say goodbye. Perhaps you haven't had this privilege. Instead, you may have lost someone suddenly and wished with all of your heart and your being that you could have been allowed the extraordinary gift of saying goodbye. Now I'm going to ask you to do something harder. Come meet Gracie and her family as they learn of her diagnosis and that she will not survive after her birth. We sit in the consulting room with the parents, grandparents, and team, doctors, nurse, social worker, child life specialist to provide them with information and answer their questions. We bear witness to their unimaginable grief and questions. How will we go on without her? Will Gracie be in pain? Will she suffer? Can we hold her, sing to her, take pictures, have her baptized, love and honor her? How long will she live? Should her 5-year-old sister be present? Will that harm her sister? How do we talk to the family members who don't agree with what is reasonable and appropriate? And that certainly happens on many occasions. Join me at her birth. She's born and lives for a bit more than an hour. They surround her, swaddle her, love her, and share her with the family. The pastor provides her with care based on their faith traditions. Songs are sung. Her 5-year-old sister, Faith, holds Gracie and gives her the twin of a stuffed animal that will sit on Faith's bed for years to come. Sharing ice cream has been a family tradition in joy and sadness. They have wished this to be part of saying goodbye to Gracie. The team has granted permission, or perhaps we snuck it in without all of the permission. A bit of ice cream is touched to her tongue. This becomes part of her legacy. Each year, on the anniversary of their tragic loss, the family gathers to celebrate Gracie's life and share that same flavor of ice cream, a connection that aids them in their grief journey. We remain connected through cards that we send on Mother's Day, Father's Day, birthdays, and the day of the loss, always acknowledging Gracie's life along with the family's grief. Many parents express that losing contact with the caregivers who shared the tragic news and the precious time at the bedside feels like losing their child again. They tell us they're grateful for her care, for the compassion that the team provided, and most of all, for helping the family to come together on what was appropriate for Gracie, so they didn't have years of recriminations from family members who had different opinions about what was appropriate and compassionate. Join me now, 11 years later, when I receive a call from Gracie's mother. She's graduating from nursing school with honors. She tells me that the strength and drive to do this came from her transformation of grief and the honor that they were allowed in the time to say goodbye. That was hard, and you were journeying through Gracie's parents and their loss. Imagine if it were your own child, niece, grandchild. Thank you for honoring their grief. This is but one of many stories over the 15 years of parents' loss, and often the transformation of their grief, enabled by reverent and holy time that they were allowed with their infant at the time of greatest tragedy. I hope that you will stand with me, with compassionate physicians and parents, to say no to LR 131 and to protect families, infants, and physicians from this government intrusion into private and intensely personal medical decisions and moments. I thank you for allowing me to share my thoughts, feelings, and experiences with all of you today.
I give my heartfelt thanks to all of my colleagues for sharing their insights this morning. These stories should affirm for us all that legislative referendum 131, if passed, will do real harm. It will harm babies who cannot survive, but who will be subjected to painful and unnecessary procedures. It will harm healthcare professionals who will be made criminals for giving the right care. These stories should affirm for us that LR 131 is not necessary. Babies born alive are already protected by clear state and federal legislation. The situations you heard about today are tragedies. They should not be made into crime scenes. We here today urge all Montanans to vote no on LR 131 and keep government out of our private medical decisions. keep the handcuffs off of our healthcare providers. So now the floor is open to questions. I think all of our professionals here would be open to questions from the press.
Yeah, question for the M&A, whether from you or from Ms. Branson, but if the referendum passes and it does become law, will the M&A challenge it?
That's a great question, Jean. I would love for you to address that. I have not been involved in discussions about that.
Well, thank you for the question. My name is Jean Branscombe. I'm the CEO of the Montana Medical Association. And the question is, would we pursue litigation should this ballot? We certainly will be exploring all avenues and options depending on what the cast and the final count is.
Thank you, Jean. Again, we're all here open to questions from the press if you have any.
I have one more. Have you heard anything about this, if being a chilling effect on providers being willing to come to Montana or to stay, continue practicing here? Is this a workforce impact?
The question is, have we heard of any impact on healthcare providers who potentially would want to come to Montana to practice? And I can tell you absolutely yes. The impact is very negative. It's having a chilling effect.
Yeah, I would agree as well in regards to those comments. I think from both sides of it, as we see legislation that continues to have criminal elements that penalize healthcare providers, the calls we get are calls that are from individuals looking to come to Montana that are going to pass on that opportunity, but it's also calls from individuals in Montana that are saying, if you can't help in this avenue, or if we can't convince them the detriment to the patients, they're going to seek employment in another state as well. So the workforce issue goes both ways. It's not helping retain, nor is it helping recruit providers in this state. I think the other element as well, and maybe Dr. Wilson can talk to this point as well, is regard to what will be the turn of event for physicians in regards to advising patients that might be in a particular situation and where they should seek care in that situation.
Sure. So I can say, as the professional organization for pediatricians, I've heard concerns from a lot of our members, some of whom have said they would leave the state if this were in effect, because they couldn't provide the best possible care to infants in the way that we currently do. And it's been causing a lot of consternation in the sense that, we're not sure now how that would affect our patient care, in the sense that if someone is in preterm previable labor, or someone has an infant with a fetal anomaly that's going to be born, should we then transfer them out of state where they would have the full array of options for how that end-of-life care would look? And that's something that, we don't have an answer for right now. We're not sure how we would handle that should it come to pass.
Thank you.
I don't know if this is best directed to understanding there's litigation if this were to pass, this would change the situation. I'm wondering if there's any discussions about, if this passes, looking to find what reasonable medical care would be. If there's restrictions historically, reasons why that is impacted by those medical things.
I can answer that, in that our organization sought a legal opinion on this bill, and we asked, is there a way to participate in a process where we could define what reasonable and appropriate medical care means, and take away the inherent contradiction in the phrase that this has to be care to preserve life and health. We were told that there is no opportunity for rulemaking on this bill, that this is a criminal bill, and that basically what would happen is someone could be brought into court and charged, and the court precedent would then define that term, which is obviously an option that we don't think is appealing to us.
Yes, sorry, one last question just about the debate about this. The recently a couple of proponents of the bill have said that, like you mentioned, this wouldn't do all the things you're saying that it would do, and that there would be more opportunity in the future if this passes to discuss and hear from providers about how it can be changed or how it can be altered. I think you mentioned the rulemaking process, Dr. Wilson.
Yeah.
When was the time for debate on this, and is there going to be time for more debate?
So this bill passed in April of 2021, and all the debate was had in the legislature. Now that it's passed, and we asked also for an opinion on this, there is no opportunity for rulemaking on the fundamental parts of the bill that criminalize this care. There is an opportunity for rulemaking only on the reporting mechanism, which is provided for in the bill. And that's obviously an important part of the bill, but a minor part, and doesn't solve the problem of criminalizing compassionate care.
I think the point is that the process is different if the bill defines a crime and penalties as compared to a bill that establishes a program or appropriates money for something. Does that make sense? Yeah.
Yeah, that's an excellent question. So for anyone that didn't hear, the question is, if this became law, how would I counsel my patients that have a baby that likely is not going to survive after birth? And the answer is, yeah, most likely I would counsel them to go deliver somewhere else. Now the problem with that is that in these cases, it's a very hard emotional thing that they're going through, and the best way to do that is somewhere where they're comfortable, where they can meet, they can go on a tour of L&D beforehand, they can have family members come and visit, they can have their support network there, and to send them to Seattle, for example, or to some other city in a different state would take all that away from them and would certainly change the experience. Even if they were still able to pursue comfort care, it still would not be the same experience they would have as if they received that here at home. Yes, so it's Holbrook.
And your first name?
Brad, B-R-A-D. Thank you.
Looks like it's it. Thank you.